Guys, after subscribing to this channel, please make sure that you also press the bell icon so that no notification, no new video of mine, any educational video, is missed by anybody.
Over here, 45-year-old, inability to get up from bed after vaginal surgery, as below you've seen the position. Hip flexion, mein she's having difficulty in hip flexion, knee extension, characteristic of femoral nerve injury, guys. Okay, the moment they say problem in hip flexion, knee extension, it is a femoral nerve injury. And I'll confirm it now. Sensory loss over anterior thigh, again specific for femoral nerve injury, patellar reflex is absent. Okay, so which nerve injury? Identify the nerve injury. Femoral nerve, very characteristic. Name the stirrups, it's lithotomy stirrups. I just told you that. Types of nerve injury, many of you have not written properly. So the different kinds of yogini, very well done. Very well done, yogini. Excellent answer, okay? And let me see if anybody else has also answered this question. So she's my star for this question. One more. Okay, I'm getting this answer from Swapna as well. Excellent, very good. And who else has written this? Okay, Shiva, I can give it to you as well. Great. So yes, types of nerve injury: neuralgia, axonotmesis, and neurotmesis. Okay, neuralgia is just a temporary conduction block, but it's not actually structural damage to the nerve. Axonotmesis, damage to the axons. Neurotmesis, complete cutting of the nerve. That's neurotmesis. Okay, you should know the type of nerve injuries. This question cannot be repeated as such exactly, but you should know that this kind of questions are also asked in the worst questions. You know, the nerve injuries. What treatment will you suggest to the patient? So your treatment is rest, physiotherapy, pain management if she's having, and rehabilitation. Okay. Follow up in neurological assessment unit. And if no improvement occurs 6 to 12 months, then only a neurologist or neurosurgeon will be able to check her best. Okay. Now, since it's already 10:06, I'll just take up 2 more stations, and then the rest of the stations I can take in the next class. Okay. So yeah, your next station, guys, I want everyone to answer. Let me just pump up my guys who are there in the class. Vinita is there. Okay, I can't pronounce, so this person gets a little, off. Ashwini, Priya, Aishwarya, I'm repeating your name again. Arsh, please answer. Vrishali, Meghna. Guys, you are my regulars, okay? You should be able to answer. Lavanya has been answering. Harsha, Yogini, I see you. Bhavna. Shreya is there. Great, Shreya. Premanand. Kaustab, Shraddha, Suman, please, Prachi, everybody should try, okay? Manisha, Divya. I have a list of my students who are there and everybody should try, okay? Okay, this is your next question. Okay, guys, you can post your answers as I speak, okay? So here, people got a little delayed. I don't know why, what is the reason? But answers are right. Everybody's answers are right. Excellent. Now, let me tell you guys, this scoring systems, I'm seeing the pattern of these OSCE questions, what they basically put one question on these endoscopic surgeries, like I just told you. One question is usually on the obstetric emergencies, okay? I'll just be following up with the injuries, the nerve injuries. If they are also coming, then I will have to be very serious about them as well, learning about them. One has to be about contraception or something. But this is a question on obstetric emergencies. This happens to be the qSOFA score that they have asked. And here, the question is very simple. Guys, can you hear my voice, everyone? Aman cannot hear my voice. Please let me know. Just give me a thumbs up if you can hear my voice, everyone. So that I can proceed with explaining you guys. Just put a thumbs up so that if you can see, you can hear me, I can proceed forward. Okay, thank you guys. Aman, please just log in again. I think you're not able to hear my voice for some reason. I don't know, but I think I'm pretty audible to the others, so that means I'm audible. Now the question is, 26-year-old woman, P3L2A1, LSCS 10 days back, altered sensorium. I'm catching on the head points like I was telling you before. Altered sensorium, high-grade fever, inability to pass urine, very important. Pulse rate 120, and she's got an LSCS done 10 days back. Had it been a recent LSCS, the answer would have been hemorrhage. Okay, no doubt about it. PPH, hemorrhage. Pulse rate 120, blood pressure 84 by 64, respiratory rate 26. Okay, what is the diagnosis? Has to be sepsis. Okay, mostly it is sepsis. Mention the parameters for evaluating obstetrically modified qSOFA score. So here, let me tell you, qSOFA score mostly has three parameters, but it can be fourth as well. The parameters that it takes are here: the systolic blood pressure, the respiratory rate, the mental status, and or not tachycardia. So first three are very important. So systolic blood pressure, any two out of the following three, if she scores a 2 out of 3, she is at a high risk of a hospital mortality. 3 to 14 times high risk of hospital mortality. So if the systolic blood pressure is coming less than 90 and the respiratory rate is more than 25 and she has an altered mental status, she is a candidate for very high risk of hospital admitted mortality rate. That's the qSOFA score. Calculate the qSOFA in this case. She has an altered sensorium. Yes. Blood pressure is less than 90. Yes. 1. Respiratory rate is more than. So she has a very bad, SOFA score. This high risk indicates a high risk of not sepsis, mortality in hospitally admitted patients, basically. Okay. Name 2 other scoring system. Many of you have written down Muse and SIRS, which is correct. Please be sure next time Muse can come. Next time SIRS can come. Okay. qSOFA can come again. So please make sure that you all know about it. Okay.